Okay, I think we're good to go. So welcome. And the purpose of this, we have new faces, both on our hub team and our network. So we just wanted to talk about what is Project Echo and bring it back to everybody. The objectives of this conversation is to share the model with you, what the Echo values are, how it aligns with systems of care, what to expect within an Echo session, and different engagement techniques that you guys will be able to utilize. Project Echo was developed in the University of New Mexico by Dr. Sanjeev Arora. He is a doctor who specializes in Hep C, and he had a wait list that was 8 months long for him to see critically ill patients. So he thought there's got to be a better way. He got this model, and it's not telemedicine, it's telementoring, so that he can talk with the different physicians around the state so that the patients could receive their specialized care where they were. By utilizing this model, his wait list went from 8 months to 2 weeks, and patients were receiving the care that they needed in their homes, in their hometowns, and the doctors were able to enhance their knowledge base. Project Echo is not just here in Ohio or in New Mexico. It is a worldwide program that touches every continent, which is really amazing. Maybe not Antarctica. I might have been false there, so I apologize. Here are the principles of the Echo model. And much like Amy Vixler Coffin, we have ABC, but we also have a D. And we use technology. We're all utilizing that right now, using Zoom and connecting from all over the state of Ohio. We want to share best practices. So when we get into the different systems and how to handle the multi-system youth within Ohio, you guys are the experts and able to share your best practices through this model. Case-based learning, each session there is a case presentation for us all to teach and all to learn. And Leslie is the web-based database to monitor outcomes, which is why we are asking to know who you are, where you're calling from, so that we know where our reach is. And we also will be asking for your feedback so that we can ensure that this program, that your time that you're spending with us is beneficial to everybody here. Sharing in best practices to reduce disparities. So the evidence-based didactics. Many of you have heard from Rick and Bobby and other experts across the state sharing the wealth of knowledge to help us treat the multi-system youth. And doing this in a Cliff Note type of version, being able to focus on one aspect, share with it within 15 minutes to a half hour, so then we also then have time for the case presentation. And that goes into the cases. We all can learn, and by connecting via Zoom and doing this network, we have a learning loop. And we have a community that we can tune into each week so we can ask our questions or share the guidance. Monitor access. There's an iEcho database that doesn't really matter so much for you guys. It's a little bit of jargon, but that's where we keep our attendance, and we also have to feed that back into the University of New Mexico. We're talking about the post presentation. So as those who present cases, we want to know how that works for them as well. So not only as attendees being able to provide your feedback, but those who are willing to go out there and put together the case presentation, because I know that's a lot of work for our case presenters. So we are always grateful that you're willing to do so. I know we have some on the call today. And with this new iteration and season of the program, we will be connecting with you a year from now to see how the attendance was for you over the year, and if it did help treat the multi-system youth that you guys all work with. Project Echo is guided by core values. So we have the model, but within the model and the practice and the networks, there's a lot of value that comes with it. The ability for us all to serve the underserved, to earn the trust and respect of our peers. I really do find joy in this work, even though I'm usually behind the scenes. Being able to demonopolize knowledge. We all have this wealth of knowledge, and if being able to share it across the state so that everybody can utilize that to treat their patients and their youth is great. And teamwork. So today is a great example. Your presenter was supposed to be here but had a family emergency. So I'm happy to step in and be a team to get this to you guys. The benefits, you see them listed here. I'm just going to let you read it for a minute because I could read the slide to you, but I think it's best if we're able to read it as well. The best thing is that we're moving knowledge and not patients. And I think a lot that strikes home with multi-system youth. They're within counties and you have resources within counties and you want to be able to keep them within your county but get them what they need. So this is a great way that we can connect and figure out what resources are available, what does the youth need. We also are able to give more information on a weekly basis. And it's a hub-spoke model that our hub is quite large and comes from all over Ohio. And just like our spokes, all of our participants, you're also coming from Ohio, when all different disciplines are represented here today. How does Project Echo align with systems of care for multi-system youth? And this is where I'm gonna, Bobby or Rick, if you want to help me here, I can speak Echo and I can speak
we'll be happy to help
makes
you.
Sense. But we do have this information here. And I know Nicole had some notes provided and she is sorry she couldn't be here today. So Rick, if you want to take these next few slides, just tell me next slide when you're ready.
Sure. So, you know, when this was, we've had a lot of work being done at the state for under the rubric of multi-system youth, number one. So kids who have involvement with many systems, more than one. And over the past, I'd say about 6 years to 8 years in particular, through some system of care grants that we got federally, thanks Holly, we've been really focusing intently on what a system of care is. And really just to summarize it quickly, it's how a system takes care of its own. So how do we keep kids in the least restrictive environment? How do we have a strength-based perspective of how we're working with them? How do we work in partnership with youth and families? How do we value and validate and respect families as we provide that care? It's really important. You know, in systems of care, you're going to find more and more as Ohio matures in their system of care implementation, you're going to find youth and parent peers involved as well. So those persons with lived experience, raising youth with multiple challenges, and those youth that have grown up and had those multiple challenges will be there to also provide support, and we're excited about those things. But a comprehensive system of care includes also those really necessary services that help communities keep kids in the least restrictive and setting, and that includes things like, you know, the wraparound care, mobile response stabilization service, intensive home-based treatment, you know, trauma-informed care, and, you know, and other services, right? So it needs to be a comprehensive set of services and supports for us all to be effective You know, today we're going to have a presentation from a smaller community, a smaller county. And so I think, you know, what we're going to have to struggle with together as a state is how do we get those services and supports out to smaller rural counties that may not have that full comprehensive set of services that some of the bigger counties have. Next slide. So, you know, and I didn't mention, and I should have at the very bottom is, you know, the other major component of system of care is having culturally responsive services where we are entering someone's home with respectful humility and as a student of the family's culture so that we can learn and best impact and help that family. Guiding principles. Well, here it is, cultural humility, family and youth involvement, community-based services, much of everything I just talked about. So let's go to the next slide. All right.
I think that switches back over to me, Rick. So thank you for filling in on those pieces, because you are definitely the expert there. What to expect during an echo session. Some of you already know this, some of it's new. We just want to do a quick refresher. And so we're going to go over the anatomy of a session. So we do the introductions and housekeeping. So we haven't got to the introductions yet, but we will. And you're listening to the didactic presentation right now. And what will happen next is the case presentation after introductions. And there's going to be opportunity for everybody to ask clarifying questions. And then once the questions are done, then everybody will have an opportunity for recommendations so that the presenting team has some things to go with them to go back for their youth. And as far as just clarification for our case presenters today, our team here will compile those recommendations for you. We want you to be able to be active and in the session with us, and we're going to capture all the notes. You don't have to try and scribble down all of the different things that will be said this afternoon. We will be happy to do, we will do that for you, and you'll get that hopefully within a few days. And lastly, there'll be wrap up and announcements, which will mainly be the reminder of that we're going to be coming back together next week and that you'll be getting information in your email to complete that post-session survey. And who we are. So there's a lot of people here. I see we have 51 participants. Our facilitation team comes to us from Case Western. So you've heard from Rick and we know Bobby. And they are our leaders and will take us through each session. Neomed has the hub designation for Project Echo, and there are 4 of us here from Neomed. Also, you'll see on the next slide, we also have Sarah Dugan. But we are the ones that will coordinate for you. Nicole does represent integrated care, and Emily here, she is our lead at Neomed for Project Echo as we embark on super hubdom so that we can bring Echo to more entities within Ohio. And our additional hub team, as I mentioned, we have Sarah Dugan, who is our clinical pharmacist. Some are not able to be here today. So Akron Children's Hospital, we had some conflicting schedules. And all of these people will not be on each session every week. We try to have them rotating so that you'll have all of these specialties each week in some capacity. We know we have Amy here today, and when Amy can't be here, we will have Chris Filler from Ocala. Wright State, there are 3 great doctors there who will rotate, and Marjorie Cook, who is also here today, to represent parents. And Kanetta, I'm trying to move my screen, I'm sorry. Kanetta McFarland is also here today and a clinical psychologist. And I do not think that slide is correct. I do not think she's at Nationwide, so we will correct that. Case presentations and discussion. Our case presenters will go through the case with Rick's help, Rick or Bobby's help. And we'll invite for questions from the community first. And again, we'll ask that you unmute to ask your questions. We do understand we have 52 participants now, and some might have questions at the same time, and you feel free to utilize the chat box as well. And then once we wrap up the questions, we will go to recommendations. And we will want to hear from you as well of how you would recommend to go forward with different services for the youth. Clarify, I mean, everybody, we want you guys to listen and ask questions and utilize the time so that we do have a learning community together. Roles during an ECHO session. So this is pretty much for everybody. We want everybody to contribute. This is not a webinar. We don't want flies on the wall. We want your expertise. You guys are out there doing the good work, and we want to hear from you. The Zoom etiquette, housekeeping things, how to mute and unmute. It's a little bit different sometimes if you're not used to it. Takes a little bit of practice, but we believe in you all and you guys can get there. A community, everybody will have different opinions and there's many perspectives, especially given the different systems that we talk about. So that's why it's even more of a value for you to share it. And we would love to see you all and turn the cameras on when you're able to. We understand there are some technical barriers in some instances, especially as some of us are still from home, given the COVID pandemic. So surprisingly, my kids have not come up to interrupt and join in this presentation. Zoom etiquette. You guys all know this for the most part, and if you have any questions, again, feel free to reach out to Kara or I. We'll be happy to help you. And there's some information if you would like to learn more about ECHO and about what Neomed is doing with Project ECHO. And I am going to turn it back over to you, Rick.